Members, we have a full house today. We have two urgent questions, and I will ask Ms Edge to ask her question.
Thank you, Mr Speaker. I'd like to ask the Chief Minister if he would make a statement on the resignation of Dr Glover from the Department of Health and Social Care.
Call on the Chief Minister to reply.
Thank you, Mr Speaker. Dr Glover has been working alongside the pathology team for a number of months to support the COVID testing programme. Dr Glover is free to make her own decisions in relation to her work with the Department of Health and Social Care, and it would not be appropriate for me to discuss individuals' contract details in this way. However, as with all those who have been involved with setting up and running our on-island testing, we value their contribution to the delivery of service on the Isle of Man. There are 56 employees of pathology, with 11 of those in microbiology, and I would like to thank them all for their help enabling us to be in the fortunate position the island is in. Thank you.
Supplementary question, Ms Edge.
Thank you, Mr Speaker, and thank the Chief Minister for that minimum response. Just with regards to really the public reaction to this, would the Chief Minister confirm who is now leading the testing? And obviously a lot of the public outcry was with regards to statements that have been made since the resignation, and particularly the reading out of a letter that didn't actually name the person, which I totally agree with. Just wonder if the Chief Minister could provide some clear clarity, really, the public would say, our Minister has just said those words within the prayers. Can you provide some clarity around this for the public? Thank you, Mr Speaker.
Chief Minister.
Thank you, Mr Speaker. Our microbiology team has always been led by Mr Khan, a consultant, highly emanated, who's given advice to the Council of Ministers on a number of occasions, and he has a team of 11 of those are in microbiology. We also have a consultant and a big team in charge of pathology. They lead, they advise different medical groups, and that's fed up to the Council of Ministers. So whilst we are very grateful for the hard work of Dr Glover and all other people who give advisory work to government, we have our own team that lead on the testing regime. Thank you.
Honourable Member Mr Ashford.
Thank you, Mr Speaker. Would the Chief Minister agree with me, as I've stated several times publicly? Dr Glover is a highly intelligent, very knowledgeable individual who is exceptionally good at the job that she does, and she has been instrumental in setting up the testing regime on Ireland. And also, Mr Speaker, can I put on record, I thought she gave an excellent presentation to members last week in relation to testing. And she deserves praise for that. Would the Chief Minister also agree that across the whole of pathology and microbiology, as a small jurisdiction, we are very lucky to have the highly skilled individuals that we do, and that both Dr Glover and the entire team across pathology and microbiology deserve our praise for giving us a second-to-none testing facility that runs 24/7.
Chief Minister.
I totally agree with the Honourable Member for Douglas North. Thank you, Mr Speaker.
Supplementary question, Ms Edge. No? No. Mr Robertshaw.
Thank you, Mr Speaker. Would the Chief Minister simply take this opportunity presented this morning to him to give particular named praise to the doctor who has provided such exceptional service to the island and has resulted in a first-class gold standard provision? Would he like to particularly and personally address that matter rather than the generality?
Chief Minister.
Thank you, Mr Speaker. I've always said I don't know the doctor in question. I think we've met once at an awards ceremony. Other than that, I can't comment on their work, but I'm told they have done a fantastic job, and I'm more than happy to confirm that to this honourable court. But I think we fall into a trap, honourable members, that there are 56 people doing a similar job, helping day in day. So yes, an individual has done a good job. I've got no doubt about that. We've had that reassured by the Health Minister, who does know the Honourable Doctor, and has clearly stated that they've done a good job. I have no doubt that that is, that it is the situation, that they've done a good job. So I'm more than happy with that. Thank you.
Supplementary question, Mr Thomas.
Thank you, Mr Speaker. I'm sure the 56 people have done an excellent job, and we thank them greatly. Microbiology is important. Can the Chief Minister cast his mind back to mid-March? Was the microbiology situation in terms of people and in terms of equipment vulnerable in mid-March? That's a question. And secondly, if we were fully staffed and fully able mid-March, why is it we needed to actually use the bank for adding to our services in terms of microbiology?
I'm sorry, that's well beyond the scope of the question. Final supplementary question, Ms Edge.
Thank you, Mr Speaker. Just really to follow on for Honourable colleague for Douglas South with regards to the services provided, can the Chief Minister confirm today who, with regards to the testing for COVID, is it a separate area within the 56 testing team, and who, and obviously grateful thanks to Dr Khan, who's head of this service, but who is actually ultimately now responsible for the testing, ensuring the tests are done and reported on within the required policy of the department?
Chief Minister to reply.
Thank you, Mr Speaker. I'm led to believe it's the same person who was from day one, Mr Khan, who leads a team of 11 in microbiology. But obviously we needed help. When you've got a sudden global pandemic and you've got other people with skills elsewhere, then it's logical that you bring in as many people as possible to help with the team. That was done, and I'm very grateful to all, including Dr Glover, for their sterling work and help us. Thank you.